Although several pregnant women were among this country's COVID-19 infections, all cases have been managed successfully. The statement comes from Director of Women's Health, Dr. Adesh Sirjusingh, who notes that some of these pregnant women became very ill with the virus. He believes it was inevitable that COVID-19 would have reached the pregnant population and adds that the risk is similar to someone who may have co-morbidities or pre-existing conditions. Dr. Sirjusingh is now urging the pregnant population to get vaccinated for the flu to guard against this virus, since he says pregnant women can become critically ill.
We were extremely fortunate that there were no deaths in the pregnant population for the 2019 to 2020 season. Despite our best efforts, however, less than 35% of the pregnant clients took the vaccine last season, and we could do better.
Meanwhile, Chief Medical Officer Dr. Roshan Parasram says the main focus is to get as many people vaccinated for the flu to protect the population. But he adds that it may be used as a tool to rule out influenza if someone presents with flu-like symptoms.
Completely that they won't have influenza, because there's a small percentage of people, of course, that take any vaccine that it won't cover that individual, but the likelihood of it being influenza will be less. And of course, COVID-19 or any other virus is, of course, more expected in those individuals. So it's a question that we do ask.
Although there were no pregnancy-related deaths due to the influenza in the 2019-2020 season, a total of 41 deaths were recorded from the disease.